Good morning and welcome to the City as Health Policy, a conference organized by Naoya Kwate, sponsored by the Center for Race and Ethnicity, and also generously sponsored by Robert Wood Johnson. The Center for Race and Ethnicity is a center dedicated to the interdisciplinary study of matters relating to race and ethnicity. The center is going on its 10th year, and one of the things that we found over the years as we look at issues related to race and ethnicity through an interdisciplinary lens, we often end up looking at issues related to health. As a result, we sponsored a number of projects and publications that deal with health, including a book entitled 3 Shots of Prevention on the HPV vaccine, as well as another book on genetics and the unsettled past that focused on new research revolving around DNA. We also have done work on food deserts, and more recently, we've become very interested in the intersection between cities and health policy. We've gone this direction largely because of our work with Naoya Kwate, our associate director, who has designed this project and found all the wonderful speakers that we are going to hear from today. Naoya is a clinical psychologist who is widely interdisciplinary in her work. She's affiliated with the Department of Human Ecology with Africana Studies, and she's also the associate director at the center. I will turn it over to her to introduce the project more fully.
Thanks, Mia, and good morning, everyone. So, so I'm the Associate Director of the Center for Race and Ethnicity and the conference organizer, and I just want to thank the Robert Wood Johnson Foundation again for their generous support that really made this conference possible. Also, Mia Bay and the other CRE staff. Mia Kissel is our senior program coordinator. So there are 8 of us, and 25% of the staff are named Mia, right? So Mia Kissel, she handled all the logistics to bring this day into being, so thanks to her. Thanks also to the 5 graduate assistants, Jessie Baker, Sally Bonet, Grace Howard, Rosemary Indebuizu, and Hakeem Zanidanov. And so all of the CRE staff are wearing yellow name tags, so if you have questions or issues or anything, they'll be happy to help throughout the day. And then Jessie is also going to be live tweeting our conference. And so if you'd like to join in as well, we have the conference info on this easel. So our account is at CRE at Rutgers, and so that's our handle. And then the hashtag is City as Health Policy, all run together. And so the Wi-Fi in the room, there are sheets on each table, so you should be able to log on. There's no username, but then you just enter in the password, which is case sensitive. So again, welcome to everyone, those of you here in the room, and also everyone out in television land, or AKA on the live stream, which is made possible by the fabulous folks here at Rutgers ITV studio. And so we'll be streaming throughout the day. Okay, so why the City as Health Policy? This conference in which we interrogate how city policies and infrastructure act as health policies. So we might start with a case study of one city. In April of last year, the Tampa Bay Times reported on tickets issued to bicyclists in the city of Tampa. Tickets and fines totaling $50 or more were levied for numerous infractions, from riding with no light, to riding with a friend on the handlebars, to riding without touching the handlebars, or riding too slowly. And so in 2014, the Tampa police gave out 534 tickets for bicycle violations. And of the 505 that the newspaper could map, 59% of those were in majority black neighborhoods. And that number becomes 82% if you expand the scope to neighborhoods that are at least 25% black. And 2014 was not an anomaly, the Times reported. The police department had been ticketing hundreds of black bicyclists each year for more than a decade. Over the past 12 years, the police issued more than 10,000 tickets, with black residents bearing the brunt of them. By and large, the people who were ticketed relied on bicycles as their primary transport. They rode them to work, to church, to school, to visit friends and family, and to do day-to-day errands. In other words, they relied on bicycles to access the resources and networks that foster good health. But they did so at some risk. One man had his bicycle confiscated by an officer, quote, due to the fact that the bicycle is worth over $500, and King was not able to produce any documentation that he bought the bike legally. I don't know how many people ride around carrying the receipts for their bicycles, but okay. So the police impounded it for 90 days, advertising it as, quote, found property. A woman walking her bike home, balancing a plate of food she had cooked and was delivering to an elderly neighbor, was also flagged down by an officer and issued a $51 ticket for not having a light. A 63-year-old man mistakenly stopped for lacking a bike light, consented to a police search, which then resulted in a felony charge for drug possession, which then resulted in his inability to obtain housing. Tampa's policing brings into bold relief the notion of health in all policies, an approach to population health that has increasingly come to the fore in public health research and practice. The approach holds that most practices and policies, public policies, have the potential to influence health and health equity, and calls on policymakers to consider the health consequences of their choices. Aggressive policing, such as that in Tampa, are negative health policies because they heighten stress, inhibit free use of urban space, and put people on a trajectory that undermines access to resources that are so critical for health. In contrast, the city of Richmond in California is one of the first in the US to adopt a health in all policies law. Jason Corburn and colleagues published an article in the Journal of Urban Health describing how the municipality enacted a law jointly developed by the city, community stakeholders, and public health officials that put health consequences at the center of public policies. The law produced a number of substantial gains for the city, including bringing in an additional $60 million a year in taxes from Chevron, drawing in the Lawrence Berkeley National Laboratory second campus, which is anticipated to bring in more than 10,000 jobs and other amenities, and redirecting $19 million to community services instead of to a detention facility. So we can really select almost any individual determinant of health, education, income, employment, health behaviors, exposures to toxins, access to health care, and find behind them city policies that make those risks and resources more or less likely. And so we need analyses on the ways in which city policies and practices that at face value are outside of the health sector are in fact very much important for health and disease. We want to consider how city policies constitute an interdependent system. So transportation policy is health policy, but Tampa shows us that law enforcement policy is also transportation policy. City life can be a quite different proposition from one end of town to another. In my hometown of Chicago, babies born in Washington Park have a life expectancy of 69 years. Get on the L, ride a few stops north to the Loop on the Green Line, and life expectancy shoots up to 85 years. In New York City, traveling on the 6 train from Murray Hill to East Harlem produces a decline of almost 10 years in life expectancy. And Philadelphia, zip codes only 5 miles apart, so if you go from Society Hill to North Philly, those zip codes have a staggering 20-year difference in life expectancy. So these data come from maps created by the Virginia Commonwealth University's Center for Society and Health, and they're funded by the Robert Wood Johnson Foundation as well, building on earlier maps that they had made in 2008. So we need to recognize at least 2 things about that. First, these neighborhood inequities are not natural or inevitable or ordained by God. They are the result of policy decisions, right? So some of those are at the city level and some of those are beyond. Second, just because the fact that the United States remains highly segregated by race, they're not just neighborhood inequities, they're also racial and ethnic inequities in life expectancy. And so here at the CRE, we wanted to convene this meeting to have a robust discussion about the challenges and the solutions to the kinds of issues that cause people in some neighborhoods to live sicker lives and to die so much earlier than others down the street. Virginia Commonwealth argues that among other factors, we can attribute differences in mortality to public transit, opportunities for residents to exercise, walk, or cycle, the extent to which local tax bases support education and income, housing, food retail markets, and more. And if those sectors sound familiar, they're some of the topics that we're going to be addressing in our panels today. So we're thrilled to have assembled such a talented and creative group of scholars, innovators, and practitioners who can help us understand where we're lacking in health-supportive city policies and provide actionable strategies. And so to illuminate why the city is health policy, we've brought together experts who can speak to a number of policy sectors that relate to city policies. You'll see that not everybody works explicitly on health, and that's on purpose, right? So we want the experts who can talk about what cities are doing for better or for worse, and then allow us to marshal that evidence for an agenda with health at the center. So let me just give you a few quick notes on the format for today. So we have a number of panels you'll see in the program, 3 or 4 presenters and 1 moderator. The moderator is going to introduce themselves and the panel, and I'll just note that because we have such an accomplished group of speakers, if we spent any appreciable time really giving their biographies, we wouldn't be able to hear any of the comments themselves. So we're going to just ask you to refer to the program where we have detailed biographies. And so the moderator will just introduce the speaker by name and institution. So after each the group of panelists has presented, we'll have a Q&A session. We're going to have mics running around the room, so the CRE staff will be able to carry a mic to you if you have a question. And I think that's it in terms of housekeeping. So with that, I'll just welcome you once again to the City as Health Policy, and I'll turn it over to our first panel, which is on food policy and urban agriculture. Thanks again for joining us.